Welcome, Global Virtual 5K Warriors. Thank you for joining us today to learn how to run well without running yourself ragged. This is brought to you by Google's Health and Performance team, along with our fabulous One Medical physical therapists. We will be spending an hour to educational deep dive with our doctors, Dr. Ritu, Dr. Sarah, Dr. Matthew, and Dr. Jessica. Then we'll have half an hour for Q&A. And now I'm going to pass the mic to Dr. Ritu.
Thank you, Grace. I feel extremely proud putting forward my team, Matt, Sarah, Jessica, who's done a fabulous job. These are running enthusiasts, and I call them experts in running injury prevention. So over to you, team.
Okay.
Wonderful.
I'm going to share my screen and then we'll get started.
Thank you, Sarah. Can everybody hear me? Okay.
Yes.
Hear me all right as well?
Okay, so I'm just waiting for the screen to be shared. Can everybody see the screen share or not yet? Not yet.
Not yet.
There we go. All right. Everybody can see that, right? Perfect. Hello and welcome to the Google Virtual 5K Talk and Forum. The presenters today are all physical therapists that work exclusively with Googlers like you to optimize your movement performance, and we are thrilled to have the chance to be here to speak with you all today about running. Next slide, please. Before we get into the presentation, I'd like to introduce myself and my fellow physical therapists, Dr. Sarah J. and Dr. Matthew Delana. Sarah treats a vast array of musculoskeletal conditions, is an avid rock climber, and has a history of treating ultra-marathon runners. Matthew specializes in sports-related injuries and has been a competitive basketball and soccer player for most of his life. I work to empower my clients to think through their own healing processes and enable them to make strategic decisions to thrive physically. I got into running as an affordable and efficient way to maintain a high level of fitness when I didn't have a lot of time or money in college. I've been running injury-free for over 2 decades, and I'm as enamored with it today as I was as an undergrad. Next slide, please. So everybody's heard of the runner's high. We're here to help you maintain a lifetime of that runner's high and avoid common pitfalls. Whether you're running for your first 5K or your 5th marathon, we want you to come away from this presentation with the tools and techniques that will help you become faster, more efficient, and less injury prone. We've got some really good news to share with you today. The same things that help you become faster and more efficient may also help you circumvent an injury. Our ultimate goal with this presentation is that you never have to come and see any of us for any running-related injuries. Today, we're going to cover the following topics. I'll start out discussing what experts know about the mechanics of running and how to run most efficiently. Then I'll hand it off to Matt to discuss the nuts and bolts of a complete and balanced training routine. Next, Sarah will debunk running myths. Lastly, we'll discuss practical running exercises using the concepts we've explored and do a little Q&A. Next slide, please. So, running is very complex and requires increased demand from the body. If you break down a run into its essential components, you'll see that it's essentially a one-legged repetitive activity which places repetitive load through the body. When you run, you're essentially pushing off the ground with one leg, generating force through the leg like releasing a pebble from a slingshot. Then you float through the air while accelerating toward the ground. Then you must land safely, absorbing all of that force and energy, which is called the ground reaction force, and do it all over again with your next step. Next slide, please. So I want you all to think of a number in your head. That number is your weight. Now, whether you measure that in pounds or kilograms, I want you to multiply it by 3. Got that number? For the average 150-pound person, they will put approximately 450 pounds of force through their body with each step over and over and over. The average person takes anywhere from 1,400 to 2,000 steps while running a mile. So that's roughly 10,000 steps per any given 4 to 5 mile run. So you can imagine how a series of single leg jumps over and over can have an effect on the body over a week, over a year, over a lifetime. Luckily for us, our bodies are incredibly resilient and they often adapt to what we're doing. This doesn't mean that there aren't a number of ways we can bolster this natural resilience and adaptability. Specifically, we can, 1, optimize our running by making small changes to our form and routine. 2, add strengthening, speed, mobility, and stability components to our training routine. And 3, we can identify when we need to change up our routine, understanding a little about the load we put through our bodies at any given point and our capacity to handle that load. I want to also emphasize that having stress on the body can be a very good thing. Beyond the body's miraculous ability to adapt and accommodate for stress, this is how we efficiently keep bones strong. It's how we build muscle mass and endurance. In essence, we can stress it and it will respond. Next slide, please. This is a nice graphic courtesy of Barnes et al. And their research. This shows that the concept of an efficient run is highly complex and multifactorial and represents the sum of various metabolic, cardiorespiratory, biomechanical, and neuromuscular characteristics during submaximal running. We know that we are able to, we are able to adapt to a more efficient run through training and other interventions. However, an economical change to one athlete may be uneconomical to another because of our unique differences in our physiological and our biomechanical characteristics. This difference in our physiology and biomechanics can lead to a variation in our training regimen, depending on what any of us need at any given point in time. Next slide, please. When we break down the components that we need for an efficient run, we need a ratio of mobility, strength, stability, and power. That ratio is unique to each individual because of your specific physiology and biomechanical characteristics. Another factor for changing the ratio is related to your goals as a runner. Depending on what your goals are, you may adjust these components accordingly. We will explain this further in detail in the next few slides. But these 4 components will help you take agency over optimizing your running efficiency while reducing your risk for injury. Next slide, please. Mobility is important for runners because it provides more efficient motion and it reduces the load by distributing that energy more evenly among your joints. The areas we often look at that are the most common culprits in regards to limitation in mobility are big toe extension, ankle dorsiflexion, which is what is seen in this picture, hip extension, and knee flexion. Having good mobility through these joints can prevent further compensations from the body that may lead to injury. Now let's talk about the second pillar, stability. Stability helps the body move in a controlled and efficient way. Its main contribution is to help you safely absorb and distribute the load impact when your foot hits the ground. Stability also helps you create a stable base when you recruit energy for another step and efficiently turns on the right muscles at the right time and at the appropriate amount. This is analogous to a spring. When you press on a spring, it absorbs that energy and then repurposes it to spring forward when you release it. Now let's move on to strength. Next slide. Okay, perfect. Strength is arguably one of the most important components to unlocking your running potential. Many people assume that because you run, you are strong. I would venture to say that you need to be strong in order to run most efficiently. You need to be strong to run and not the other way around. As mentioned previously, each limb accepts 2 to 3 times the body weight with each step. Let's break this down and see exactly where that energy is going. The structures that accept the ground reaction force are your passive shock absorbers, which are your bones, cartilage, and menisci, and your active shock absorbers, which are your muscles and tendons. Your primary active shock absorbers are the quads, the gluteals, and the calves. Most movement impairments observed during running, jumping, and sports activities are actually due to poor hip strength and control, as seen in the last slide. We see most athletes underutilize the hip, but there's a vast potential to optimizing your run using these powerful muscles. So using these muscles and strengthening these muscles can help you improve your hip utilization and can lead to improved hip, pelvis, and trunk stability. And it can improve that shock absorption and help you rely less on solely using your quads. The key musculature that we tend to include in our training regimen are the core, the glutes, the calf, and the foot intrinsics. Inadequate shock absorption results in too much overload of bone and cartilage. It's no coincidence that we focus our strengthening on the muscles that we ask the most of when we run. Next slide, please. When we are talking about power, we're essentially talking about strength with speed. You can think of this as your ability to be explosive. For example, strengthening is doing a single leg squat. Power is exploding into a squat jump. Let's break down how this works in greater detail. As you physically speed up your body, the body adapts by recruiting the elastic quality of the tendons. Tendons can recoil elastically much faster than muscles can shorten. Therefore, this gives us a short boost of energy right when we need it, as the tendon takes up on a spring-like quality. This is called elastic recoil of the tendon. Again, with each step, we take 2 to 3 times our body weight is loaded and distributed throughout the body. But 50% is then unloaded by this elastic recoil from our tendons. Think of this as free energy. Active muscle contraction coupled with the elastic recoil from our tendons help decrease the load that we may otherwise feel through our bodies. Regarding time spent on power exercises, this may be a more prominent part of training for sprinters and long jumpers and those who have a goal of attaining top speeds. Next slide, please. Although overall it's healthy to load and stress the body, running has been associated with a significantly high risk of injuries. Up to 50% of regular runners report having more than one injury each year. That number increases significantly when we when we distinguish between novice runners who face a significantly greater risk of injury when compared to recreational runners. Running poses a higher risk of injury over other forms of aerobic exercises such as walking, swimming, and cycling. On a broader scale, we can look at injuries in regard to when and how they happen. Some injuries are caused by a specific incident, but most are caused by overuse. This means that something has been done again and again and again and has in turn stressed that specific tissue that is involved. The highest risk injury at the knee is the patellofemoral pain syndrome, which usually presents as pain right below the kneecap. The most frequent reported calf injury is Achilles tendinopathy, and the second most frequent injury is medial tibial stress syndrome. The good news is that often the techniques that you will learn today that improve your running will also help you combat and reduce your likelihood of attaining these overuse injuries. Next up, Matt will discuss the details on balancing your workout routine and the overarching concepts of developing your own training regimen. Take it away, Matt.
Hi, everyone. Like Jessica said, my name is Matt Delina, and I'm going to be mainly talking about the ways to think about both the stress you put on your body with running and then how to design your training program. And I think one of the biggest things and maybe one of the most important things to think about when thinking about running in your training is this load capacity relationship. And so when we're talking about load, we're talking about the amount of stress you place on your body with each step, as Jessica was talking about 2.5 to 3 times your body weight. And then your capacity is your body's ability to handle the various amounts of stress. I think another way to think about it is load being what you're asking your body to handle, and capacity is what your body can actually handle at that moment in time. And so a lot of times if you slowly increase that capacity, slowly increase the load that you're putting on your body, your capacity will come along and increase with it. And only you can really get in trouble is when you start to really load your body too quickly and don't give your body enough time to adapt. And I think the next slide, can we go next slide, please? Can really show a couple examples about that. So on the far left, you can see that the load in the blue and the capacity in the red are equal. And this would be maybe if your training load has remained constant for a really long time and your body is used to that. The second part of the bar graph where it says body adapts. So if we wanted to increase our training, maybe we wanted to increase our mileage slowly, or maybe we wanted to increase the amount of times per week we're running, or maybe we wanted to increase our pace. If we slowly increase the amount of load we're putting on our body, that capacity side of the equation would slowly rise to meet that load, and our body would adapt and we'd be able to do more and more without pain or injury. However, if we do it incorrectly, so if we go to that excessive load part of the bar graph there, you can see we placed far too much load on the body compared to what our capacity was in that moment. And therefore, that's going to lead to a much higher risk of pain or injury. Not to say that every time you far exceed your capacity, you're going to get hurt, but your risk goes much higher in that case. And then kind of the far right graph there, if we have gone, there's kind of two situations can present there. If we have gone really far past our body's capacity, as in with the excessive load example, our capacity, the red, will actually reduce from where it previously was. And now it's much easier to accidentally pass your body's capacity because it's lower from where it was before. In addition, you could have been training correctly and done more of the body adapts example and slowly increased your load, and you thought you were doing everything right. But sometimes if you have poor sleep, poor nutrition, you're not allowing enough recovery between runs, your body's capacity can go down even if your training routine is going at the right pace. So you need to pay attention not only to how much you're increasing your training load, but how your body's feeling and how your body's recovering through sleep, nutrition, and those kind of things. Next slide, please. I think this slide does a really good job illustrating kind of that load capacity balance you need to strike, kind of like a teeter-totter. So if you're increasing your volume, meaning the kind of amount of miles you're running per week, your intensity, meaning like your pace, or your frequency, the amount of times per week you're running, you're going to really tilt that load capacity balance toward the load side. On the other hand, if you're working on your strength, strengthening the muscles to handle those repetitive impacts that Jessica was talking about, or you pay attention to that you've had a previous injury and are kind of training that slowly back to where you were, you can kind of tilt that teeter-totter balance back towards the right side there. Next slide, please. So I think this slide talking about the envelope of function kind of really closely relates to the load capacity relationship we were talking about. So if you look on the picture there on the left graph, you'll see that there's kind of a manageable and an excessive envelope, they call it, that you can do. So basically in the manageable part of the graph, it says jumping from 2 meters height or running for 1 hour. So those are things that your body can handle really well and not have pain or risk of injury. Versus in the excessive category, you have jumping from a 3 meter height versus 2 and running for 1.5 hours versus 1. And so once you get into those ranges, you're outside of your body's quote envelope of function. And that the thing is that envelope can change. So what was manageable at one point maybe won't be manageable in the future. So for example, on the right part of that graph, after an injury, that envelope has reduced. So the things that are manageable for you have gotten smaller. And so now the things that used to be manageable, that jump from a 2 meter height or that running for 1 hour, are no longer manageable, are now in the excessive part of the graph. And so now you have to think about every time you have an injury, you're going to need to work yourself slowly back in to slowly increase that envelope and that the things that fall under that manageable category. You can't just go back to the things you used to do and assume they're going to be non-painful. I think a really good example of this with running is maybe you're someone who pre-injury was someone who ran, multiple times a week, did maybe a 10-mile run, like 3 times a week. But after injury, you may find that only after less than a mile or even a few steps, you may feel pain. And so you're gonna have to slowly increase the level of your running very gradually in order to slowly increase that envelope. Next slide, please. And so I think a really good thing to do to help track your training and to progress your training gradually is to keep a training log and think about these questions when doing that log. And I think when you ask yourself these questions, you kind of want to think about it in 2 ways and kind of marry these 2 concepts together. And one is kind of the objective questions to ask yourself, like what is my mileage, what is my pace, and maybe how long my time of total running is, and track those so that you're not increasing them too quickly. And the other thing is the more subjective parts of that equation. Am I sleeping enough? Am I waking up feeling good, or am I waking up feeling tired and run down? Am I having any pain? And if so, in what joints or where? Is that pain consistent, or is it just a one-time thing and is it gone? Am I getting enough calories in my diet to kind of promote optimal recovery? So I think those kinds of questions are really important to ask yourself when you're designing your training program. And then let me go next slide, please. And so I created this as an example of a training log, and I think this isn't you have to be exactly what you do, but I think it's a good example, and it shows, you can see that I do like the total time that you ran, the distance you ran that day, your pace, your effort level, and any notes about how you felt during your run that day. And then you'll notice something really important about this training log is that there's built-in rest days, and that is allowing for optimal recovery because your body can't really perform at its best unless it has time to recover from the runs before it. And so I think, and you'll see all at the bottom too, I have weekly tallies of both the time and the distance, and then how I felt that week as a whole. And so I think this can be a really good example of a way to track your running and your progress. And so knowing that maybe total weekly mileage this week was 27, next week you can't just jump up to 40. You might need to go 28 and then 29 and so on as you progress your distance, if that's the thing you're trying to progress. Next slide, please. So then I think a really important concept when developing your training program is this concept of periodization. And so at its essence, what periodization is thinking about splitting up your year into training blocks or blocks of time. And a lot of times this is done in weeks. So for example, you may have a 4-week training period where you're trying to increase your load slowly. But if you do that, you want to follow that by a period of training where you have less stress on the body, where you have a rest period, so maybe where you're keeping your training constant during that period. So for example, you may have a 4-week training period where you're trying to add 2 miles over that 4 weeks to your training load, and then you would follow that by not adding miles at all for a couple weeks to allow your body to recover. And I think this concept of periodization, like alternating between increasing your loads and then resting or staying a load constant is a really good way of preventing overtraining and throwing off that load capacity balance that we talked about earlier. And I think with that, you can kind of think about you not wanting to increase too many of the factors of your running at once. So for example, you don't want to increase the amount of times per week you're running and also go longer distance each time you run. You would probably want to pick one of those factors to increase at once, whether it be frequency, intensity, or duration. And then again, I kind of threw this on the slide too, just kind of those questions you want to ask yourself in regards to your training and knowing when it's a good time to do some periodization where you allow for some scheduled rest. And then I think a good example of this, oh, sorry, next slide, please. And then kind of going along with this is that when you're thinking about recovery, you think you kind of need to balance these two concepts of catabolism and anabolism. And so a catabolic process happens basically when your body is breaking down tissues. And that really happens during any exercise, but we're talking about running in this case. So as Jessica was mentioning earlier, those repeated impacts of 2 to 3 times your body weight, over time, that's going to cause your muscles to have small breakdowns and micro tearing, which is completely normal and not a problem and not something you should be scared of. But it is something that your body needs to recover from. And that would be the anabolic process of your body building up new tissues. And that only happens during recovery. I think a lot of people think that when we're exercising is when we get stronger. And that's actually not the case. Exercising actually breaks down tissue, and we need to allow rest for that exercise breakdown to recover and be built up stronger. I think a really good example of this would be like a bicep curl. As you're doing a bicep curl, you don't get stronger as you keep curling. You get progressively weaker as your body breaks down tissue and gets tired. When you actually get stronger and your body builds up that muscle bigger is that night when you're eating, when you sleep. And so I think it's really important to know that you need rest and recovery to build yourself stronger. It's not just about the exercise itself. Next slide, please. And so where do I start? I think that's a really important question. I think if you're new to running, maybe this is your first 5K or maybe, only a couple times you've ran before, I think a really good place to start for a lot of people is alternating between walking and jogging. So for example, maybe you do a 2-minute walk followed by a 2-minute jog and you do 3 rounds of that. So that'd be about 12 minutes total. And, from there you can see how your body reacts. We talked about this. Do I feel okay in the morning? Am I having aches and pains, etc.? And if your body's reacting well and you're not having any negative effects, then you can slowly either increase the total time that you're doing this, or you can start to invert the ratio of walking to running. So for example, you were at a 2-to-2 ratio. Now you might only walk 1 minute and run 3 minutes and see how your body reacts to that until you're slowly running the whole time. If you're more of an experienced runner, I think a good general rule is increasing your intensity at 5 to 10% per week. And, when kind of relating back to what I said before, you don't want to change too many factors at once. So that 5 to 10%, that may be your mileage, or that may be your pace, or that may be your frequency of running per week, but you don't want to do all those at once. And I think not everyone is the same. I think that 5 to 10% isn't, hard and fast rule for everyone. I think kind of what we've said, you need to listen to how your body's feeling. For you, it may be more 3 to 5%, or for someone else, it may be 15% that they can handle. But I think 5 to 10% is a good kind of baseline to start. Next slide, please. And then how do I know if I'm progressing too quickly? I think this is a really good way to think about this, and a really easy way to think about this is kind of the green light, yellow light, red light scale. So green light being on a 0 to 10 like pain or discomfort scale, 0 to 3 being I have very low levels of pain or discomfort, and I'm safe to gradually increase my training load. My body is recovering well from these workouts. Whereas yellow, you're more in that 4 to 5 out of 10. And that's kind of saying, put on the brakes a little. You don't need to stop, but your body, you're probably pushing the limits of your load capacity relationship. And so your load's just probably slightly over your capacity level at that point, which is your body will adapt to if you give it time, but you can't keep increasing your load at that point. I think when you're in the yellow is when you kind of need to stop at the load that you're at, let your body adjust to that load before you start increasing again. And then red, being you're in that 6 to 10 range, you've kind of far surpassed your capacity with your load. Your load is much too high, and your body's telling you that. And that's at a point where you need to back off your training or decrease the amount of training you're doing so that you're back into that yellow or green range. And then next slide, please. Now, Sarah is going to talk more about myth busting and common myths with running.
Okay, So we're gonna do some myth busting. We're gonna bust some myths in regards to foot strike, shoes, running form, running and strength, and stretching. So to wear shoes or not to wear shoes. Sarah Giotto surveyed recreational runners and asked them, what do you think can cause injuries in runners? The majority of their answers were related to footwear and or foot strike. In the last decade, barefoot running or running in minimalist shoes were hot topics of discussion, especially after Christopher McDougall's book, Born to Run. But before we can make a decision about footwear, let's learn first about different foot strikes. What we're looking at here is what part of the foot hits the ground first. There are 3 different types of foot strike: heel strike, midfoot strike, and forefoot strike. A heel strike, also called a rear foot strike, is where the heel makes first contact with the ground. A midfoot strike is where the heel and the ball of the foot strike the ground at the same time, and a forefoot strike is where the ball of the foot makes first contact with the ground. Recreational runners were found to have a rear foot strike, and elite runners were found to have a midfoot or forefoot strike. Based on the observation that elite runners have a forefoot strike, we come to our first myth. Forefoot running will make me a faster runner. Ardijo et al. Did a treadmill study where they looked at runners who typically heel strike and those who typically forefoot strike. They gradually increased the speed of the treadmill and observed their foot strike. Turns out both heel and forefoot runners demonstrated a forefoot strike as speeds increased. The foot adapted to the speed at which they were running. Speed did not increase due to foot strike. This could explain why a forefoot strike is found in elite runners. They're simply running at higher speeds, not necessarily because they trained themselves to be forefoot strikers. But what about injury rates? Doesn't heel strike cause more forces through the legs? Myth 2. Forefoot striking reduces injury and heel striking is bad. There are no mechanical advantages or disadvantages between either foot strike. In fact, forefoot strike places more work done at the ankle, and a heel strike places more work at the knee. This is important to consider when looking at injury prevalence. Someone who forefoot strikes may have more Achilles injuries. Someone who heel strikes may have more patellofemoral injuries due to the loads placed at the ankle and the knee joints, respectively. In fact, injuries occur when people try to change the running form or foot strike pattern. We cannot recommend one foot strike over another, but we do know that the load demand on the lower body changes depending on what foot strike a runner exhibits. Going back to the load capacity relationship, we need to consider, is my body strong enough to withstand these loads depending on what foot strike I have? What about barefoot running? Will that reduce my risk of injury? Myth 3, I should switch to barefoot running. When running barefoot, more work is done at the ankle joint or the calf and the Achilles, very similar to the forefoot strike. When running in shoes, more work is done at the knee joint or quad and patellar tendon, similar to the heel strike. If you do decide to make the switch, too quick of a transition can cause an overload to the triceps surae, which is the gastroc, the soleus, the Achilles. This is going to throw off that load capacity balance. Remember, most injuries occurred when runners tried to change their foot strike. In summary, there are 3 different types of foot strikes. One is not better than the other. Different foot strikes place loads on different areas of the body. Our bodies need to be strong enough in certain areas depending on our foot strike pattern. If you're a heel striker, you may benefit from doing more knee or quad strengthening. If you're a forefoot striker, you may benefit from doing more ankle or calf strengthening. Regardless of what foot strike you have, you need to be strong enough to withstand the loads and impact of running. If you decide to become a barefoot runner, you better make sure your foot and your calves are strong enough. And a certain foot strike is not going to make you any faster. Now that we cleared up foot strike, let's move on to footwear or shoes. If there's no ideal foot strike, is there an ideal shoe? If you go into a running store, you'll most likely be fitted for a shoe based on your foot type: supinated, pronated, or neutral. A supinated foot typically has a higher arch, The pronated foot typically has a low arch or flat foot. A neutral foot is somewhere in between. Most likely, you'll be prescribed a cushion shoe if you have a supinated foot, a stability shoe if you have a neutral foot, and a motion control shoe if you have a pronated foot. These are all types of traditional running shoes. Sounds like an easy algorithm to implement, right? It turns out it's a lot more complicated than that. Running shoe prescription based on the previous slide is not evidence-based. So what does the research say? Nate et al. In 2015 proposed that individuals should choose what shoe they wear based on a preferred movement path. Does the shoe allow me to move in the desired direction, aka forward? And the comfort filter. Choose what's comfortable for you. This was later challenged and disputed by Linderfer et al. In 2020, stating that there's no evidence that using the comfort filter will reduce the risk of running injury. So we're back where we started. Since there's no conclusive evidence on a traditional running shoe, what about a minimalist shoe? Myth 4, I should switch from a traditional running shoe to a minimalist shoe. Minimalist shoes aren't a new concept. Traditional shoes have only been around for the past 50 years. But with all this shoe technology, why are people still getting running-related injuries? Solution, let's just go back to running in minimalist shoes. But is that going to reduce running-related injuries? Turns out running in minimalist shoes isn't so different than running in traditional shoes. There's no change in running economy or running mechanics between the minimalist shoe and the traditional running shoe. We can't recommend one over the other. Unfortunately, there's a lot of conflicting and poor research done when looking at injury rates and types of footwear. Based on the most recent studies, a motion control shoe may benefit those who have pronated feet. But in conclusion, more research needs to be done in order to confidently prescribe a type of running shoe. So far, we learned that there isn't an ideal foot strike or ideal shoe. There has to be an ideal running form, right? Myth 5, I should change the way I run to fit the optimum running form. Let's do a pros and cons list. First, let's consider the cons of changing running form. The more one runs, runners can self-optimize their own form in regards to stride length and step rate. We learned earlier in the presentation that loads aren't reduced. We just move it around. For example, if we ask someone to change from a heel strike to a forefoot strike, we know that we're just moving the load from the knee to the ankle. And lastly, there aren't many high-quality studies done looking specifically at injured runners. Most studies are performed on healthy runners. Now let's look at the pros. There may be a reduction in load, improvements in pain, and improvements in economy. For example, reducing stride length or increasing your step rate is shown to improve running economy. Overstriding is thought to increase load on lower body tissues, so changing this may reduce load on the lower body. When changing running form, we don't have to make big changes. A small increase in step rate is thought to reduce loads on the lower body. Lastly, exercises alone aren't going to change the way a person runs. If you see someone who has excessive pelvic drop, which is indicative of weak glute musculature, strengthening their glutes isn't going to fix their pelvic drop. Running is a skill, and people need to learn how to optimally use their muscles and joints. This can only be done through practicing running. Just like shooting a basketball, the only way to improve is to practice shooting a basketball. The bottom line is that each runner is different and needs to be evaluated at an individual basis. What will work for runner A may not work for runner B. A physical therapist can help identify your individual needs and provide you an individualized training program. Here we list some common running form considerations. Remember, changes don't have to be big, and each individual will need different things. Overstriding is when your foot lands too far in front of your center of mass. This can lead to higher loads through the lower body. Are your muscles strong enough to withstand these loads? Step rate goes hand in hand with overstriding. When you increase your step rate, you may be less likely to overstride due to the quick turnover. Pelvic drop is when the pelvis is no longer parallel to the ground, as you can see from the image on the right. This places increased load on the hip musculature and is strongly associated with common running injuries. Lacking hip extension decreases the spring effect of the lower body. Remember, think of the body as a spring, providing up to 50% of free energy to propel yourself forward. Please consult with the PT for an individualized assessment. For many runners, running is the only exercise they do, which leads us to myth number 6. Running makes me strong. Let's reflect on what we learned about running. Running is a bunch of single leg impacts over and over again. Your body needs to be able to withstand these impact forces through your passive and active shock absorbers. Your active shock absorbers are the muscles and the tendons. These structures need to have enough strength to absorb, store, and then release the forces, regardless of how far or how short you run. Think of your body as a spring. In addition, recall catabolism. Running is a catabolic exercise. Muscle tissues are broken down to provide you energy in order to continue running. The body needs to rebuild the broken down muscles. But how? This is where resistance or strength training comes into play. Running doesn't make you stronger. Strength training makes you stronger. This is supported by the research. Resistance training reduced overuse injuries by 50%. Most running injuries are overuse injuries based on the repetitive nature of running. Strength training can improve your running economy and performance. And 2 to 3 days a week of resistance training is recommended. We train in order to optimize our running. And the last myth we'll discuss is static stretching. Static stretching will prevent injury. We're all familiar with what static stretching is. Get into a position where you feel some tension and hold for, say, 30 seconds. There are multiple studies that do not support static stretching as a way to prevent injury, improve performance, or reduce the incidence of delayed muscle onset soreness. It was even found that static stretching during a warm-up could decrease muscle strength and performance. In order to become optimal runners, we need our passive shock absorbers, the bones, joints, etc., and our active shock absorbers, our muscles and tendons, to work effectively. We need our joints to be mobile enough to create the spring effect. For example, big toe extension, ankle dorsiflexion, hip extension, knee extension. And this could be done through a dynamic warm-up, which is more movement-based and not a static hold. Follow this with running-specific drills. We need to practice running in order to be good, skilled runners. Mobility is having both movement and control, where stretching just improves flexibility. Don't get me wrong, flexibility is still important, and static stretching can get us there. But we need to find a happy medium between being too stiff and too flexible. If we are too flexible, like the right side of the scale, our bodies act like a floppy spring, which isn't very efficient. If we are too stiff, like the left side of the scale, our bodies don't have the compliance to absorb the forces. So let's tap into that free energy and be efficient springs. Now we're going to go through some exercises that can help unlock your potential to be an efficient runner. These exercises take into account the key components of running: mobility, stability, strength, and power. We'll go through the foot, ankle, the knee, the hip, and the low back. Just a disclaimer, these are for general use and by no means meant to be a prescribed exercise program. For individualized evaluation, assessment, and exercise program, please see a physical therapist. We'll start from the ground up at the foot ankle. First, we have a mobility exercise to improve ankle dorsiflexion, followed by an eccentric heel raise off a step to strengthen the calf musculature, progress to jumping rope to build power in the calf. Moving on to the knee, we know we need to have good knee extension to propel ourselves forward via that spring analogy. Performing triple extension heel raises places our hips, knee, and ankle into the position for that final push-off phase of running. Follow this with quad strengthening and stability exercise of a split squat, and then a jump squat for explosiveness. At the hip, we address its full mobility of this ball and socket joint by doing hip cars. Follow this with a single leg deadlift to improve single leg strength and stability, as well as controlled use of the hamstring. Further improving the control and strength of the hamstring and glutes, perform a bridge to an eccentric heel slide. At the low back or core, warm up with a mobility exercise with cat-cow. Pair it with a stability work like a forearm plank, either on your toes or your knees. And you can progress to a side plank with hip abduction, either on your feet or your knees. So what we want you guys to take home is that there's a ratio between the key components of running: strength, mobility, power, and stability. We need to strike a good balance with loading the body and resting periods. If you want to progress your training, do it in 5 to 10 increments and don't choose too many parameters at the same time. Think of your body as a spring and utilize that free energy. Train to run and not the other way around. And remember, every body is different and there's no one size fit all. For a personalized evaluation, assessment, and exercise program, feel free to contact us at any time via email. Make an appointment with us using the One Medical app or website. We're listed under specialty services and then physical therapy. You can also call the number you see on the screen. We see patients both virtually and in person, and we are more than happy to help you achieve your running goals. Here's some references. And then we're going to go into a Q&A section. We're going to first answer the questions in the Dory, and then we'll take any questions you guys may have. Okay. So we have some questions in the Dory. I'm just going to read them out loud. And then either myself, Jessica, or Matt can kind of jump in and answer the questions. So the first question we have: any tips specific to cold weather running, especially as it relates to warm-up, stretching, and cool down?
I guess I can handle this. I think, as Sarah just talked about, stretching really isn't something, or at least static stretching, you want to do as pre or post run, as far as like either injury prevention or increasing your performance. So you don't even need to worry about that. As far as warm up, I wouldn't say cold weather makes a huge difference as far as what you want to warm up. I think you want to do a dynamic warm up, whether you're running in normal temperatures, warm or cold weather, and which includes like going through range of motions while placing some strength component on them. So kind of there was a slide where someone was like hugging their knee and then kicking out their leg. So you're going through those motions that may be not flexible for you, but you're doing them in an active way. And Sarah or Jessica can chime in on this.
Yeah, I agree with everything Matt said. I think this is a really great question. I'd like to just add and reframe it a tiny bit by saying that coming into cold weather, like let's say you're training in San Francisco and it's October, so the weather is glorious. Having a prior exercise routine and training helps improve cold tolerance in general. So taking these aspects from our presentation today, applying those methods and those thought processes, and then thinking about it holistically as in, hey, I'm actually, I am what I do. If I come into this cold weather with an established routine, my body is going to be much more able to adapt to that cold.
We had a question chime into the chat that's related. How about running in Seattle weather during November and February?
Good question. I wouldn't change my answer. I think just using these concepts that you're taking away today, and then thinking about adding mobility, stability, strengthening, all of these components, having that training in place will serve you well.
Okay, moving on to the next question. Running is the only form of exercise that I enjoy while we self-isolate, and I try to go out 4 to 5 times a week. As part of a regular exercise regime, what should I focus on? Going farther or going faster?
I think kind of what we talked about in my part of the presentation. I don't think it matters. I think you can choose what your goals are, basically. Is your goal to run farther or to increase your pace, or is it both? And if it's both, I think you need to just choose one at a time. So if you're running maybe 3 miles a run right now, slowly, and your goal is 4, slowly work your way up to that 4 miles. And then once you're there, then you can start trying to increase your pace. I just wouldn't try to increase both at once.
Yeah, I fully agree with Matt's statement. That's exactly how I would handle that as well.
I would also encourage you to try to fit in some type of resistance or strength program throughout the week. Remember, only 2 to 3 times a week is sufficient. We have to be strong to run. So in order to increase that speed or increase that mileage, you have to make sure that you're strong enough to get there.
Yeah, I totally agree with that.
Okay, next question. I'm lazy.
I would say we got one in the chat too. I don't know if we want that now or at the end.
We'll answer that one after the Dory. Okay, so the next question is, I'm lazy and in a rush. What is the bare minimum you would recommend for a warm-up and cool-down routine? So I think we kind of talked about the warm-up in regards to having a dynamic warm-up, having it be something with the mobility paired with some strengthening. And then in regards to cool down, we just want to make sure that your heart rate goes back down to like that resting heart rate for you. So whether it be taking like a walk after your run, just to kind of bring the heart rate down. Stretching is fine. It's not bad when you do it as a cool down, but that shouldn't be the only thing that you do.
Yeah, I was just going to add.
Sorry, Matt. I was just going to add, I think everything Sarah said was great. I would add that, really check in with your body as well. I was on a run last week and had tight calves because I wasn't doing my own strengthening, and I just stopped right at the beginning of that run and did some heel raises off of the curve, and that resolved, and then I could just keep going with my run. So I was troubleshooting on the spot. It's probably not best practice, obviously, but check in with your body and make sure that is, if there is something that you're feeling that just doesn't feel quite right, like think about these concepts and try to apply.
Yeah, the only thing I was going to add was just, it doesn't have to be very long. It can be as short as 3 to 5 minutes, but just getting the muscles that you're going to use during the run warm. So like the quads, the glutes, the calves, getting them activating a little bit, contracting a little bit. And it doesn't have to be a super high intensity thing, but just getting them kind of contracting a little and ready to go.
Okay, next question. On and off, I have knee problems, and the usual diagnosis is this is rooted in our lifestyle, sitting all day. The fix are physical therapists, strength, mobility exercises. How would I recognize the point when the problem exceeds lifestyle and consider further intervention, like knee arthroscopy, etc.?
I think for that one, I would only ever consider surgery after all conservative treatment has failed. So I think if you've seen improvement from physical therapy in the past, whether that be strengthening, mobility, or both, that's a good sign. That means it responds well to that. And that's maybe just something you need, as like we talked about in this presentation, you need to add strengthening as a more regular thing into your routine, not just maybe do it when you're in physical therapy and then trail off when you're out of physical therapy. I think if you want to be a regular runner, you need to incorporate strengthening all the time, and that should hopefully prevent those knee injuries from cropping up. But in regards to if you should seek further intervention, I would say generally I would not go the surgical route unless you really have to.
Yeah, and I just want to add with that, pain in the research, pain is actually not directly correlative with the pathoanatomy. So pain is its own thing. So what you need to think about are what Matt was talking about as far as like, hey, if I do this one strengthening exercise, check in with your body before you do that exercise, see how that feels, do the exercise. Did it make your knee feel better? Did it make it feel worse? Or is it about the same? And then you can kind of go through these separate variables and see what is actually super helpful. But pain, especially at the knee, it to a certain extent, like we talked about in our presentation, it's not necessarily telling you anything about the degenerative process or the anatomy of what's going on inside the knee.
I think we can also use that red light, yellow light, green light analogy when we think about, is it exceeding my lifestyle? So maybe you're exceeding your running mileage or running speed, etc. But you can also apply that concept to strengthening. Maybe you're choosing too high of a resistance when you're doing your strength training. So you may have to back it down. So kind of use that stoplight analogy when assessing more than just running. Okay, next question is how to avoid patellofemoral syndrome.
Yeah, I think a lot of that kind of comes back to our presentation is that a lot of it's about the load capacity relationship. I think if your muscles, especially like your quads, glutes, hip musculature aren't handling the loads of that repetitive stepping well, it's going to transfer those loads to more of the joint, where i.e. the kind of like tendons or cartilage or things like that in the joint. And so you're going to have a more likelihood of feeling, overuse pain in the joint if your muscles aren't handling that well. So I think a really good way to avoid those kind of injuries is, or maybe even not injuries, that sort of feeling that pain there, is to incorporate strength training into your routine so that those muscles can handle those loads, and to also make sure you're gradually increasing your training load.
Okay, next question. What about cross-training to benefit running and using periodization in conjunction with cross-training?
I guess by cross-training, I'm not sure if they mean strength training in addition to running, or more like biking, swimming, all that kind of thing.
It's not specified.
I could add, I was thinking any one of those or all of those, some combination. I mean, weight training seems, again, you're saying that strength is a pretty important component, but just using your body in a different way as a way to sort of expand your ability to do what you're doing even while you're doing your running.
I think I'm not sure if they want to add on this, but I guess I have two thoughts on this. Kind of one is that if you're, let's say you're normally a runner, but then you go biking one day, that might take a little bit of the load off the things you use when you're running. So it may like almost promote recovery in a way, that because it's not placing the same loads on the same things you are when you're running. But then on the other hand, I also think kind of train for what you want to do. So you can't just bike a lot and expect it to translate to running. I think, it might generally strengthen you, which is great. But I think, if you're trying to increase your running distance or your pace or things like that, you basically need to train running. You just got to do it in a smart way, progressively, gradually, and include some strength training in there just to allow your body to accept those loads. And maybe Jessica and Sarah have more to add on that.
I would say that choosing other types of cardio exercise, like the biking or like swimming instead of running, is a good way to kind of give yourself that recovery. from running itself because they are less impact to the joints with those. But still want to reiterate that strengthening for your specific activity is going to be important. Okay, next question. From knee or ankle injury point of view, is running on treadmill better than running outside? Also, in case of running outside, should paved hard surfaces be avoided? Okay, I can take this one. I think it has to do with, is your body strong enough to withstand the different types of impact that running on these different surfaces give you? So if you run on a treadmill, it's typically going to be softer, less impact than if you're running on like a hard surface. Same with a paved dirt trail is typically going to be softer than running on like a concrete surface. But I don't think that you should avoid running on concrete or sidewalk altogether. You just have to make sure that you are strong enough, your muscles are strong enough to withstand those types of impacts.
Yeah, I think just adding on to that, like maybe if you're doing like a hard paved surface like concrete, like Sarah said, you need to be strong enough to handle those loads. And if you go on a softer surface, it's potentially maybe making your ankle work a little bit harder as opposed to your knee. But other than that, yeah, Sarah kind of covered it.
Okay, thoughts on hip-foot coordination exercises, i.e. runner step up, incorporated in warm up, cool down?
I would say it's if that's kind of what you're targeting as what you need, then having that in your routine somewhere, in your week somewhere is a good idea.
Yeah, I think if by runner step up you mean kind of a step up with like a knee drive at the end, then yeah, that can also obviously mimic kind of the motion you do with running, and it can also like activate your quads, your glutes, a lot of things. So yeah, I think that could be a really good way to warm up. I mean, maybe not the only thing you do, but at least one of the things you do.
I think doing a coordination-based exercise is good to kind of warm up your lower body in preparation for the coordination that it needs when you do go on your run. Okay, next question. Drinking a protein shake, is it better before or after the run?
I've actually looked a lot into this just for my own personal use, and a lot of the research says basically it doesn't matter, or if it matters, it's so little that it's don't spend too much time worrying about it. I think if you're getting enough protein in your diet and you do it somewhere close to your run, you should be fine.
Okay, how about pain on one side of the hip? What part of the body is weak?
I mean, I can go again. I just feel like I'm hogging the spotlight here.
It's fine if you don't want to.
No, go ahead. I don't mind. Yeah.
I think that there could be lots of things that are weak in regards to one-sided hip pain. It could be your hip itself. It could be your low back. It could be your knee stabilizers. It could go all the way down to your foot and ankle. If you don't have a good base of support all the way down at your foot, it could translate up the leg into the hip. So that one's a little bit hard to give you a specific answer because it could be anywhere along that leg.
Yeah, I think my answer was going to be I would at that point I would go see a physical therapist and have them evaluate you. I think at that point you need an evaluation and they can figure out exactly what's wrong and what to strengthen. I think it's hard to give like abstract advice about that because everyone could be different about why they're having their hip pain.
Mm-hmm. Okay, next question. For active plantar fasciitis type heel pain localized to the heel, would eccentric heel drops, raises to the floor or off a step / raised platform make more sense? Looking to strengthen without making the condition worse.
I mean, yeah, I think in general that's something we give a lot of our plantar fasciitis patients. I think it depends on how painful it is for you or how acute it is. I think if you're going through a ton of pain, you might not be able to tolerate that off a step, especially right away. But if you're not in a ton of pain, I think that's definitely a good way to work on that. I think kind of going back to like the red, yellow, green stoplight thing, similar to when you're running, you can use it for when you're doing rehab exercises too. If you're in the green zone, it's probably fine. If you're in the yellow, be careful. And if you're in that red zone, you might need to back off, and that might be too hard for you at the moment, and you need to start with something easier and work your way up to that.
I mean, I would also say that, our presentation is a general presentation. For this specifically, the best practices are to add a stretch of the gastrocnemius musculature. So adding a 30-second stretch, a 30-second to 3-minute stretch, and incorporating that also into routine is best practice.
Oh, and if you don't know gastrocnemius, we mean calf.
Yes. Thank you, Matt. I usually do try to translate these words.
Okay, next question or statement. Part of the argument in Born to Run was that running on uneven surfaces like dirt paths challenges foot intrinsics to function better overall. Is there evidence that this is the case?
I haven't looked at the research, but I would guess that probably running on uneven surfaces does challenge your foot and ankle more. Just in general, does that lead to decreased injury or better performance? That's a different story. So,
yeah, I fully agree with that. What Matt said, it definitely places more. It shifts that load again for the ankle and foot to accommodate more. So you have to recruit that musculature, and therein your body will accommodate for that.
Okay. I am running as a weekend warrior about 2 times a week, which provides me with some cardio exercise. Over the years, I noticed I've been getting quite a bit slower. How could I change my training regime to keep the speed and endurance that I have? I would say maybe add another run into your week, just so you're not only running on like Saturday, Sunday, just so you are conditioned to run whenever you want to run, instead of just doing like kind of big blocks of running at a certain time of the week. I think that'll help.
I also think adding training can really help with speed, especially. I think speed, what it comes down to, is how much force you can push into the ground when you're running, and how much force you can push into the ground when you're running comes back to how strong your muscles are and how much they can push. And if they, maybe also with the endurance, if they fatigue quickly. So maybe you want to work not only on strength, but endurance with the strength training as well. So doing high number of repetitions of things.
Okay, anyone familiar with the book and practice of Chi running? And if so, thoughts? I personally have not looked into Chi running or have heard that book, so I can't answer that.
Yeah, I'm not familiar either, sorry.
Yeah, I'm actually not familiar either. So I'm not really sure.
What type of self-massage and care would you recommend for recovery? Is inversion yoga pose helpful? Well, typically the self-massage things that I prescribe are, the foam rolling exercises. With that said, it's used in conjunction with mobility and stretching, or mobility and strengthening, and not just foam rolling. Inversion yoga pose helpful. I don't know any research about that, but it seems like it will offload some of the joints. And it will help work on your stabilizers, since you have to use your core to stay in those inverted positions. Okay, next question. I run with my puppy. She stops and bolts unpredictably. Any suggestions for me to help with warm-up?
I mean, I don't think it changes warm up that much. You might want to incorporate in your training a little bit more things that have you start stop more, like power exercises. But other than that, I'm not sure if it changes your warm up per se. I mean, maybe Jessica and Sarah have a different opinion.
I would say make sure that you have some type of core strengthening and stability training. So then when the puppy does unexpectedly pulls on the leash, then your stabilizers will be ready for that.
Yeah, and I would just add that you would want, like, I would add something like a single leg stance on foam, something with a maybe a potentially a balance coordination, something that will train your muscles to be able to adapt quickly to that that component of surprise.
Will we be able to access the recording of this meeting? Yes, you will.
I think the answer is that.
That's about using yoga poses with isometric loading in conjunction with stretching as a form of strength training for running.
Personally, I think isometric strengthening is great, and it's actually some research has been shown that it helps with like tendon health and tendon pain. But I think it does need to also be combined with concentric or eccentric training, which is like the muscle getting shorter while you contract it and the muscle getting longer while you contract it. I think you need to kind of incorporate all three to have the best results. But I think isometrics are great, and yoga poses, a lot of them are really great at creating an isometric contraction.
I like yoga that is more like movement based because it's very similar to like mobility training, learning how to use your muscles in a coordinated fashion. And then with the isometrics, like Matt said, it has there's evidence saying that it has some pain relieving aspects to it. But if we think about running, thinking about that initial contact when your foot first touches the ground, we need to be able to control that deceleration, which is the eccentric strength training. And then when you look at the last portion of that push off, we need to be able to have that concentric strength. So I would say that we need all three aspects of strength training: the isometric, the concentric, and the eccentric when we look at running as a whole. Okay, last call for questions. Thank you for all your questions. They're really good. I think they were really informative for everybody.
Yeah, I think they were really good questions too.
And I just add the resource put together by our One Medical team, additional resource. If everyone wants to check it out, it's in the chat. I do have clients and friends asking, hey, I'm trying to lose some weight. Is running a good exercise for that? What are your thoughts?
I would say it's a good exercise because it's cardio-based. Typically, the cardio-based exercises are going to be helping with weight loss.
Yeah, I would fully agree with that.
Yeah, I was going to say I agree too. I think just the only thing to consider is if you're someone who hasn't run before or hasn't run in a very long time, just ease into it slowly.
One thing I thought was very interesting is when I do strength training, I feel my trainer is always pushing me to 110%. And with that same concept from what I heard today, it might not always be great when I'm building my own strength for running.
Yeah, I think pushing 110% in what you said, that might be slightly going over your body's capacity, which is not necessarily a bad thing because your body, as long as it's given the time to recover, will increase its capacity to match that. So I don't think that's a bad thing in its core. I think it's only could be bad if you don't give your body time to recover and allow it to kind of adapt to the stressors you've put on it.
And Matt, earlier when you show your own calendar, you have 2 days per week that you take time off.
Mhm.
Are you taking time off completely from exercising, or you're doing different type of exercise during that time?
First of all, I just want to throw it out there. That is not actually how much I run. I made that up. I don't run that much. Um, but I honestly chose 2 days, and I didn't choose it for any particular reason. I just kind of like made up a scenario where maybe the day before my rest days, like if you looked at my notes, they were feeling a little more fatigue or pain, and kind of thought, and then wanted to associate that with, oh, maybe tomorrow should be a rest day. But yeah, I mean, I don't think you necessarily have to take a break from all exercise those days. I think it depends. I mean, especially maybe those days you could do upper body training or something if you wanted to give your lower body a rest. I think it also depends on how your body's feeling. Like if your lower body's really run down, I think even doing lower body weight training on those days could be problematic.
And I just want to piggyback off of that. Like if you need more than just one rest day, that's totally fine. Also, you can take more than 1 day of rest.
Mm-hmm.
Yeah, I think the key component there. Oh, sorry, Sarah.
Oh, I did that. Listen to your body, kind of check in.
Yeah, exactly. That's exactly what I was going to say is really monitor, even though you're having, if your trainer is pushing you 110% while you're actually doing that, is your body up for the challenge, right? Like, and then you check in after and say, hey, did that increase any kind of discomfort in my body in general for the next 2 days? Use that red light, green light, yellow light system, and then move accordingly from there, adjust accordingly.
Yeah, I think just any training program, kind of going back to what I said in the slides, like you got to account for the objective, like the amount you're doing, but also the subjective, how you're feeling.
Yeah, my trainer is my puppy. So in one of the slides you mentioned earlier, also checking with your mood and stress level, which I really appreciate that. A lot of times in our mind is no pain, no gain. So sometimes we would push through the pain and it takes, I think, take a week to recover, which is maybe too much of a load for the body, for the whole system.
Yeah, I think we just got another question in the chat. What about periods of rest or reduced activity, i.e. a week or 2 weeks? I don't think that that's necessarily a bad thing, depending on how hard you've been loading yourself. And you can also, do active recovery in those times, meaning you can walk or do things that are very lower loads on the body, but are still active. But I don't think you'll lose too much progress in a week, especially. Maybe 2 weeks you'll lose a tiny bit, but probably not a lot.
Yeah, I think that goes back to your previous question, Greg, in regards to cross-training, like choosing a different type of exercise.
Strengthen the knees to an extent, but it might not be enough depending on how much you're running and how hard you're running. I think it depends on the person is the short answer, I guess. I think for some, maybe more lighter recreational runners, it could be enough. And for others who run more or longer distances, you may need to do more actual strength training.
Thank you, everyone. We hope you have a great day.
Thank you.
Thank
Bye.
you.
Bye.